This training module addresses travelers' diarrhea, medically known as TERESA, which stands as the most prevalent health issue encountered during international travel. Understanding its causes, prevention, and management is critical for ensuring the health and safety of personnel operating abroad. Our objective is to equip you with effective strategies to minimize health risks. Travelers' diarrhea is an intestinal infection resulting from the ingestion of food or water contaminated with pathogenic bacteria or viruses. The onset of symptoms is a direct consequence of exposure to these microorganisms, to which a traveler may have no pre-existing immunity. The primary goal of any travel health plan is to prevent this initial exposure. To effectively combat this health risk, we utilize a structured three-pillar approach. This involves understanding the etiology or cause of the illness, implementing proactive prevention strategies, and following established management and treatment protocols if symptoms arise. Mastery of this information prevents significant disruptions to your travel itineraries and professional assignments. All water for consumption, including for brushing teeth, must be from a verified safe source. This includes commercially bottled, filtered, boiled, UV-treated, or chemically chlorinated water. A critical but often overlooked risk is ice, which is frequently made from untreated local tap water and must be avoided entirely to prevent contamination. Food safety is paramount. Only consume foods that have been thoroughly cooked and are served at steaming temperatures. Foods from street vendors present an unacceptably high risk of contamination and must be avoided. Furthermore, all food items that may have been exposed to flies or other vectors must be rejected immediately. When it comes to produce, fruits and vegetables are safe only if they can be peeled or shelled by the consumer personally. This physical action removes surface contaminants that may be present. If you can't peel it yourself, it is safer to avoid it to ensure no pathogens are ingested during your meal. Personal and environmental hygiene is a fundamental practice. Frequent and thorough hand washing with soap and water is the best defense. In situations where soap is unavailable, the use of an alcohol-based hand sanitizer is essential to prevent the hand-to-mouth transmission of pathogens while you're traveling or working. In the event that prevention fails, a structured response is required. The condition is typically self-limiting and resolves within 3 to 5 days. The primary and most critical treatment is maintaining adequate hydration to prevent dehydration. This involves a steady intake of clear liquids, such as bottled water or clear broth. While hydrating, you must avoid caffeine and alcohol, as these substances can exacerbate dehydration. For vulnerable populations, such as young children and older adults, a prepared oral rehydration solution, or ORS, is highly recommended. These solutions provide the necessary balance of electrolytes and fluids needed for a safe and speedy recovery. Medical intervention is indicated for moderate to severe symptoms that disrupt plant activities. Indicators for seeking advanced treatment include persistent vomiting, high fever, significant abdominal cramps, or the presence of blood in the stool. If you experience these red flag symptoms, you must follow the protocol for advanced medical care. A pre-prescribed antibiotic, such as azithromycin, is appropriate for moderate to severe cases. It is imperative to consult a physician for a prescription before your travel begins. Having these medications on hand allows for immediate treatment under the guidance of the medical advice you received during your pre-travel consultation. For individuals aged 6 and older who do not have a fever, bloody stool, or severe abdominal pain, the antidiarrheal medication loperamide may be used for symptomatic relief. However, it is important to remember that this medication only manages the symptoms. It does not treat the underlying bacterial or viral infection. In the absence of commercial ORS mixes, an emergency solution can be prepared by mixing exactly 6 level teaspoons of sugar and 1/2 level teaspoon of salt into 1 liter of safe water. Extreme caution must be exercised, as an incorrectly mixed solution can be hazardous, particularly for young children and infants. In summary, managing travelers' diarrhea risk rests on understanding the cause, rigorous prevention, and a structured response. The most effective tool is prevention through disciplined food, water, and hygiene practices. Should symptoms occur, prioritize hydration and follow medical guidelines to ensure a successful and healthy international travel experience.